Good afternoon, and welcome back to Health Leaders' The Winning Edge program, a weekly series of webinars touching on topics and strategies that you need to know the most. My name is G. Hatfield, and I'm the CNO editor for Health Leaders and will serve as your moderator for today's session. Today's webinar is titled The Winning Edge for Advancing Nursing Advocacy and Legislation. Thank you to you and our audience for participating. Before we get started, for those of you participating in the live program, I have a few housekeeping details. Our program will be approximately 60 minutes in length. Note that an on-demand version of this program will be available on our YouTube channel on Friday and can be accessed through our website, healthleadersmedia.com. To ensure that you can see all of the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resources list for today's webinar on the upper right of your screen. Here we have listed the webinar slide deck and some additional materials for you to download, along with a registration link for the future The Winning Edge events. At the bottom of your console are multiple widgets that you can use. To submit a question, click on the Q&A widget. It might already be open and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our esteemed panelists for today's discussion. First, we have Rudy Jackson, who's the Senior Vice President and Chief Nurse Executive at UW Health. We have Dr. Natalie Nicholson, who's the Chief Nursing Officer at Denver Health. And finally, last but certainly not least, we have Claire Zangerle, who is the CEO of the American Organization for Nursing Leadership and Senior Vice President and Chief Nurse Executive for the American Hospital Association. So thank you all for joining us. And with that, let's get into our discussion. It's great to see all of you. So first, I want to go around and have each of you tell me a little bit about yourselves and your organizations. If Rudy, you want to get us started.
Sure. Thanks, Gene. It's great to see you again.
Yeah.
As Gene mentioned, my name is Rudy Jackson. I'm the Senior Vice President, Chief Nurse Executive at the University of Wisconsin Health System. We are located in Madison, Wisconsin. It is a scorching 82 degrees right now. So for those of you that are in the South, I don't want to make you a little bit jealous. We are a 7-hospital system. Our system is a little bit unique compared to most, where I have direct operational oversight of nursing. So all of the CNOs report up directly to me, and they are triad partners of their individual hospitals. So just a little bit of a nuance that most systems don't have here. We have about 6,500 direct care nurses in our system, and about 22,000 employees, give or take.
Awesome. Yeah, I'm definitely jealous of your 82 degrees. All right. And then Natalie, what about you?
Good morning, and thanks for having me. Honored to be here with our fellow nurse leaders to talk about something I deeply believe in, and that's the power of our collective voice. So as she said, I'm Natalie Nicholson. I am the CNO of Denver Health. We're located in Denver, Colorado. We are the safety net hospital for the state of Colorado. We have about 555 beds, 19 school-based clinics. We have the paramedic 911 system. We have well over 15 federally qualified healthcare centers. I could keep going on and on, but we definitely provide and support our community here in Denver. Thanks.
Absolutely. Yeah, thank you for being here. And then Claire, what about you?
Hi, everybody. Thank you for having me, G, and welcome to my fellow presenters. I'm Claire Zangerle. I'm the Chief Executive Officer of the American Organization for Nursing Leadership and the CNE for the American Hospital Association. AONL is a subsidiary of the American Hospital Association, and we support more than 13,000 nurse leaders across the nation and internationally. We are focused on advocacy, which is a great topic for us to be talking about right now. Community, the community of all of our nurse leaders together collectively, and education of our nurse leaders. We are governed by a board. I have a board of directors that makes up all of the 9 regions across the country. And we are considered the voice of nursing leadership and enjoy the community of all the nurse leaders across the country and seek to support our nurse leaders in helping them support the teams that deliver care. I just started this job about 7 months ago, but I've served on the board of AONL twice and the board of AHA one time. So the last decade, I've been involved intimately with the organization. Prior to this position, I was the chief nurse executive at Allegheny Health Network in Pittsburgh, 14 hospital system. Prior to that, in Cleveland, which is where I'm from and based. I'm originally from Texas, but lived in Cleveland for 30 years. I was the chief nursing officer at the Cleveland Clinic and was the CEO of the Visiting Nurse Association of Ohio. So the view from acute care to post-acute care and beyond has really informed my nursing leadership. So very excited to talk about this topic to you guys today.
Absolutely. And we've got a fellow Texan here, so that's cool. Alrighty. Well, to kick off this discussion, according to a 2023 study, the number of nurses serving as legislators has actually declined from 2013. And in 2023, there were only 72 nurse legislators across 36 states. According to the American Nurses Association, there are only 3 nurses currently serving in the United States Congress. So with that being said, this year, as this year progresses under a new administration with lots of new ideas about legislation and policy, it's more important than ever that CNOs and other nurse leaders get involved so that nurses can be the ones advocating for nursing. So I wanted to ask all of you first and foremost, what are some of the biggest policies that are impacting nursing that CNOs should be keeping an eye on? And I'll have Natalie get us started.
Well, I'm sure we could all agree it's workplace violence and safety that is really at the top of, at least here in Denver, my mind and what we're advocating for. One of those senators is a nurse that you speak of only 3, and one of them is here in Denver. And he's been a very big advocate for workplace safety and decreasing violence in healthcare. And so really been working with him. He's worked with our local chapter of AONL, so our CONL, our Colorado Nurses Association, and local hospitals to really learn about what the hospitals are doing for workplace safety and then how he can impact and do something legislative. So this year we were able to pass something. We're going to actually get a committee together of all those representatives and talk about how we can impact across Colorado and not just for certain hospitals. So I'm excited to work on that this fall.
Mm-hmm. Claire, what are your thoughts?
Well, I absolutely agree that workplace violence is high on that list. But given what happened last week with the passage of the Big Beautiful Bill, we also have to think about how vulnerable all of the hospital systems are, no matter your size, from rural to academic medical centers, and the effect it's going to have on our patients that are most vulnerable, and the impact that that's going to have, and how that's going to have a downstream effect on nursing practice and delivery of care, with the cuts to Medicaid and rural health in general. So I think that's something that even though we as nurses don't look at it as a direct impact on our practice, it absolutely will be, and it's just going to compound what we deal with in terms of clogging up the emergency departments and access to care and those types of things. How can we be part of a solution and think about ways that we can continue to interact with our legislators to let them know that some of the enactments are not going to help. I mean, we also have to think about things around the rules around telehealth, advanced practice nursing, so that those patients and all of the patients can have access, skilled nursing facilities and staffing there, and really scope of practice and payment. I think those are all important things that are on top of our list as well. And of course, AONL does support the Save Healthcare Workers Act. At our recent Advocacy Day, we had several hundred nurses there walking the Hill, talking about this, making it a federal offense to assault a healthcare worker. It's great that it's happening in states, but it's not in all states where it's an offense. We have to make that a federal law that happens, and bring attention to workplace violence, because that is what's keeping people from entering the profession, and it's what's causing people to leave.
Absolutely. And the numbers, the workplace violence numbers against nurses are quite staggering. I'm sure we all know, but yeah, it's pretty crazy. Rudy, what are your thoughts?
Well, I agree with both. I had the privilege of being able to testify to our legislators to amend our Healthcare Violence Act to include verbal attacks and also increase the penalty for that. We got that passed a couple of years ago. I think, there was a recent article that was published by Becker's. It said 700 or so hospitals are at risk of closing in the country. I'm from San Antonio, Texas, and so I always have a tendency to go to Texas, but 87 hospitals are at risk of closing in Texas. In Wisconsin, where I live, it's significantly less, but these are big numbers when you think about 700 hospitals. So when I think about legislation, I think a lot about the ability for our advanced practice nurses to expand their scope and be able to support some of the rural areas. And so there is some legislation that I'm getting involved in around that space. I also think there's a lot of discussions around mandated ratios. As a nurse leader, I think mandated ratios are a mistake. I've been very vocal about that. I think there's things that we need to be doing, looking at workload, looking at acuity. But anybody who's actually taking care of patients at the bedside knows that no two patients, even with the exact same diagnosis, are the same. And so mandating ratios can actually be more problematic than helpful. But then there's also some softer things that we need to get involved in. I had the opportunity to get involved recently with some legislation around compensation for daycare workers, because if daycare costs go up as daycares are going down, that impacts our workforce and our ability to be able to keep our nurses in our buildings. And so there are some very, very tangible legislative things that we need to get involved in, but there's also some of those softer ones that may not have a direct impact on nursing, but have a very strong indirect impact on nursing that we need to get involved with as well.
Absolutely. So to piggyback off of that, what are some of the ways that CNOs can really get involved in the legislative process? And Claire, I'll kick it to you first.
Well, I think first and foremost, we have to recognize that the legislative process is local, state, and federal. And hitting all of those is very important. Building relationships with local leaders is super important, because once you build those relationships with the local leaders, then you can also build those with state and federal leaders as well. Recognize that hospitals and health systems are usually the largest employers in your area, and it is very important that they understand, all legislators understand how those healthcare issues, including nurses, are going to impact the people that vote those people into office, their constituents. I think it's important for CNOs to understand that consistency builds credibility. The more you're at the table, the more you're setting the table, the more your perspective helps drive all the decisions that are made by those lawmakers. They do listen. The more you talk to them, they do listen. And they act when they hear from you, because we all know how trusted nurses are, just in general and through all the survey, the survey that tells us that over the last 23 years, that they trust those local health leaders. They trust that information from you. And honestly, lawmakers are 3 times more likely to support a policy message when that message comes from somebody in their community, somebody that they can have that conversation with. And I think really the most effective advocacy starts with knowing who has the pen, knowing who is going to make those decisions, and understand what health committees they're on, who the budget decision makers are, and honestly, the congressional health staff. It's important to get to know them, and that's what they're there for. So it might be outside the comfort zone of a CNO, but there are ways to learn how to do this. And I think most importantly is recognizing regional, state, and federal. Local, state, and federal is so important. You've got all 3 of those, that triad to hit, and that makes you stronger in your message and perhaps results.
Absolutely. And Rudy, what are your thoughts?
Yeah, I agree. I would say that it sort of depends. If I live in a small rural community and it's a small locally owned hospital, definitely getting involved with the local leadership there is going to be really critical. But when you're in some of the systems that really drive a lot of the decisions for the rest of the state, getting involved with your hospital association is critical. And so partnering, every hospital association that I've worked with, based on the multiple states that I've worked in, has a nursing arm, and really getting in with them to understand what their missions are and where their vision is and where we're trying to take nursing from a state perspective. I could not agree more that we need to make more change at the federal level. And I absolutely agree with Claire. I typically use a different term than if you're not at the table, you're setting the table. I tell folks that if you're not part of the discussion, then decisions are going to be made for you without you. And so it is absolutely imperative that we be involved in those decisions and in those conversations. So for me, it's getting with the hospital associations for our state. Most organizations have a government relations person, really partnering with them as any nursing issues come up, or anything that would impact our nurses come up, partnering with them to really be navigating those conversations with those legislators. And like Claire said, I connect with a lot of aides, send a lot of emails and send a lot of notes. Sometimes I do it as a CNO of my organization, as a CNE of my organization. Sometimes I do it as a person that lives in that area, because I think it's important that we continue to advance our discipline.
Absolutely. And I think it's, you hit the nail on the head with approaching it either as a CNE or as a private citizen, because I think oftentimes we forget that we can also do that. We're all Americans. So
yeah, Gee, not every decision is, I think, as I've talked about this with CNEs, not in CNOs, not every decision is consistent with the direction of the individual organization, and of the strategy of the organization. And when that comes about, it doesn't mean that our voices are silenced. We're still citizens that should have the ability to voice our opinions based on our expertise of our discipline.
Absolutely. And would you have any advice for CNOs who are maybe trying to delineate between like their personal voice and their professional one?
Yeah, so what I oftentimes will do is talk to our CNO, and I just have very frank conversations with our CNO and say, here's what's going on and here's what I'm thinking. The CNO has a different, the CEO, I'm sorry, has a different perspective of the landscape, the board of directors. Our board is 100% politically appointed. And so he's got a very different perspective of the politics that are occurring. And so if there's anything that I'm going to be advocating for at the legislative level that is going to be inconsistent with our strategy, our strategic plan, or our mission or vision of the organization, but it's still something I feel strongly about, doesn't mean that, again, I need to be silenced. I just do it under a different hat.
Mm-hmm. Absolutely. And then Natalie, what are your thoughts? How can CNOs get involved?
Well, Claire and Rudy both hit the nail on the head with quite a few topics. I think relationships is key, right? The more we can partner, the more we can learn, not only at the local level, but at the federal level, but pairing up with our hospital association and just really building those relationships. I also found like using stories really drives the point home. So whether that's nursing stories around workplace violence, or recently we invited a bunch of our legislators to our hospital with patients that are on Medicaid to talk about why they're on Medicaid, why work requirements were going to hurt them, or make it difficult to stay on Medicaid. So that was really impactful, them telling their stories, not only for themselves, but some of them for their children. I think it had a really good impact, obviously. Not as much as we would have liked, but I think it still gets that awareness out, and we have to keep telling those stories, not only from the staff perspective, but from our patients' perspective. Another thing I think of is kind of on what Rudy touched on is making sure that we're not only using our professional voices as registered nurses, but also making sure that we're using it as a CNO or a CNE in the way that our organization wants to do it. And I agree with Rudy. I have good conversations with my CEO because our board is all politically elected by our mayor. And so sometimes that strategic organization view is a little different than mine, but I tell her right up front, hey, I'm sending a letter, I'm calling my legislators, but as Natalie Nicholson, not as the CNO, and she totally supports that. So that's always good to have those frank conversations with your CEOs. And the last thing I would say, we have to continue to build a pipeline of new nurses, younger nurses, and how to help them become advocates and use their voice and not be silenced or just go, well, we're going to keep our head down and hopefully our bubble will protect us. We really need them to get out. And I encourage participations in peaceful demonstrations. I encourage writing letters. I've mentored some of the new nurses that want to get involved. So I think we have to really work on building that pipeline. And one of the things I definitely have them first thing do is join AONL, because there's so many good tools that are right there and helps guide them in how to be a good advocate. So.
Absolutely. And all of you have kind of touched on it a little bit, but I wanted to ask, what are some effective ways for CNOs to participate in those public hearings and roundtables or even health policy briefings? And Rudy, I know you have experience with this, so I'll kick it to you first.
Yeah, it is not uncommon for me to, on occasion, be a bit of a bull in a china shop. I spent 27 years in the military and was taught very early on that if you've got an opinion, you need to speak up. So I know that's not everybody's comfort zone, but I do think sometimes showing up at some of these hearings and voicing our opinions is important. There's always an opportunity to hear from the public, and being able to speak passionately about the issues that we're facing is really important. I think when we have those opportunities, we need to not only be able to articulate ourselves, professionally, but also we need to be educated as we're communicating the message. And so really dialing in the data and understanding, because numbers speak power. And so when we're sharing something like X number of nurses are injured in our workforce, that's a powerful message that a legislator can then understand. And so understanding our data, speaking up, and just expecting to be heard. I mean, this isn't one of those typical situations where you walk into a boardroom and everybody wants you to be silent. They want to hear from us, but more importantly, they need to hear from us. So speaking up in those public settings is incredibly critical.
Absolutely. And Natalie, what are your thoughts?
I agree. I think being there in person, like, I know our schedules are busy. I know it takes a lot of time, especially if, you don't know when testimony is going to be heard or when it's even going to get. But I think being there in person is very impactful, because, with technology, it's great that we can be on WebEx or Teams or whatever they're utilizing, but you can't look in their eyes and tell the story and have them feel your passion about why you're there. So I've made it a point for any of my testimony, it's done in person. I also offer for any of nurses or any of our staff that are going to want to give testimony that I will be there with them. Because, the first couple of times it is a little scary. You are a little nervous. It's something that a lot of people have never done. And so I think bring support and being there with them, it just helps them feel like confident and like they could do it. So I definitely believe that providing testimony in person is really important.
Absolutely. Yeah. Public speaking can be scary for everybody. So absolutely. And then Claire, what are your thoughts?
Yeah, I agree with all the points. A couple other things I would add is making sure that as chief nurses and chief nurse executives, you build that relationship with your hospital government relations department, because most hospitals have one. Maybe the rurals don't have one, but most hospitals do. And being that subject matter expert on like Natalie said, storytelling, because you will become the go-to for the government relations department, because they don't always know, they're not clinical mostly, and they don't know the nuances that as a nurse leader or as nurses in general. And having that relationship with them means that you are able to have that going in. And then the other thing is, and this seems very basic, but some people don't even know who their lawmakers are. It's very easy to go to the government website and find out, who put your zip code in there, and just find out who your senators and your Congress people are, and on the local, state, national level, and just know that. I think a lot of us sometimes, with the redistricting and things like that, check out on that. But it's important to know who they are, because once you do, you can sign up for their newsletters. You can follow them on social media to find out what they're actually doing, and that's a good way to get to be known, and to actually get to be able to be invited to things, or just show up at some of their events. That's when you find out they have events in your area. You may get inundated with some spam from them, but it's better than not knowing. So I suggest doing that.
Absolutely, yeah. So Rudy, I know you mentioned this earlier, and I wanted to touch on this with all of you. What nursing data should CNOs keep an eye on to present to legislative partners? And Natalie, I'll have you take this one first.
So data is really important. I look at a gamut of a few different things. So turnover rates, patient outcomes, so those nursing sensitive indicators, nurse vacancy data, and then I think, patient experience data is all really important, especially depending on the topic or the story we're looking at, or the legislative piece that we're reviewing. The turnover rate, the nurse vacancy data, and patient outcomes really is around workplace violence and staffing. But definitely feel like patient experience has a place when we are sharing data with our legislative.
Absolutely. And then Claire, what are your thoughts?
Well, I do think numbers are very powerful when it comes to the advocacy tools that you need, especially when you combine that with the stories and the impact of those stories. Mm-hmm. Because when we were talking earlier about, how do we talk about controversial topics? If we think about the end game and what is the effect on those we serve, which is our patients and our community, then there's really no question about how we approach this, especially with that data. They like that local flavor of data because they come together, their neighborhoods, their communities, they come together to tell that story, and they need those specifics. They can't just shoot fish in a barrel. They have to understand how many of their patients are on Medicaid, what's the compensated care picture look like, what is that workplace violence data? Because we're all inundated with data, but they need data that's specific to their particular constituencies.
Mm-hmm. Absolutely. And then Rudy, what are your thoughts?
Yeah, one of my favorite sayings is we are data-rich, information poor, because we have, to Claire's point, we have so many different inputs coming in with all of this data. Natalie talked about all of the nurse quality indicators, and all of those data points are incredibly important. But I also think, to Claire's point, being able to dial it in specifically to our area. So if I'm having a conversation with a legislator and I say, here are the national trends for nursing and for our workforce of the future, and specifically, here's what it's looking like for Madison, and here's what it's looking like for our state, it has a lot of power for them. It has a lot of impact. And that data is at our fingertips. I mean, we can get this data. AHA, the American Hospital Association, AONL, the American Organization of Nurse Leaders, they have that data in there, and we pull that stuff up all the time because it's all relevant information, and you get historical data as well that you're able to lean in on. And so I do think it's critical for us to have all of those data points at our fingertips. And I will say this, not only with our legislators, but even with our non-clinical colleagues in healthcare, data is important. And so when we're having conversations around things like benchmarks, or things around like productivity, work hours per unit, all of those different things that we need to be aware of, it's important that we're able to articulate ourselves and then justify those decisions that we make, or those hypotheses that we have, through the data and through the analytics that we need to be successful.
Absolutely. And the other thing we've all
can I
been...
just,
Of course, yeah.
Sorry, I'm just going to throw a plug in here, but I don't think we as nursing leaders have done a good enough job managing our data. And a lot of times our data has to be fed to us by other entities of the organization. So, one of the things that we're doing at UW is really standing up a nursing data analytics team so that we own our own data, so that we have nursing eyes on our data, And so we're actually looking at sending our nurses back to the University of Wisconsin to get special training in statistics and in analytics, because I don't think it's appropriate for us to rely on others without our expertise who can't tell our story about the data that we have in front of us.
Mm-hmm. Absolutely. And that's still a perfect segue. The other thing all of you have kind of touched on is storytelling. So I want to give each of you a little opportunity to do that. Do y'all have any examples to share of times you were involved in policy advocacy that led to positive change? And Claire, I'll let you go first.
Yeah, I agree. Storytelling is so important. When I was leading in the state of Pennsylvania, one of the things that passed legislation was the Nurse Licensure Compact Act, and it took forever to get that done. And it's still, the Advanced Practice Act still hasn't passed quite yet. So the interstate agreement is so important because it allows nurses to practice across state lines with just one multi-state license, and everybody knows how valuable that is. And that federal support for that portability certainly impacts workforce mobility for telehealth, health systems that are across state lines. And bringing that to the legislature, their thoughts were, if we allow nurses to leave the state, they're going to leave the state. And our argument to them was, if we don't allow them to practice across state lines, they're going to leave the state. So let's just go ahead and make it where they can practice across state lines, and they will decide where they want to practice, or they'll practice in both areas. So that was pretty important for us. So when we told them that story, it kind of was like a light bulb that clicked on for them. And I think you just have to bring it down to examples of how things happen. It's funny because you always think, well, I can get things done and funding if something happens to a decision maker and we take care of it. Like if somebody gets sick and then they see what we do every single day because they had to experience it, they have a totally different view. And that's when you're telling stories to kind of personalize it to who you're telling that story to. And we were able to do that in the state about the Nurse Licensure Compact, and it happened. So it was great.
Yeah, that's awesome. Rudy, do you have any examples?
Yeah, I think, when you think about storytelling, sometimes, you're tugging at, the things that are important to the people that are hearing those stories. Sometimes it's just a matter of just laying out the facts. And sometimes it's really about dialing in what it's going to have to their individual constituents, the impact it'll have. And I can think of a couple. One, when I was in New York State talking about a bill that was coming across regarding mandated staffing ratios, and being able to have a conversation with legislators to explain the nuances of that and what the impact would be financially, and helping them understand that a stable patient in the ICU that may have DKA versus a patient on a medical surgical unit that may have an eye injury that has 2 1-hour eye drops are two very different and distinct workloads for that nurse. And as nurse leaders, we should be navigating that conversation, not mandating these ratios. Those are important stories to be able to share. But I think also, as I think about this article that just got published through Becker's around those hospital closures, having our legislators understand that patients may have to leave their homes and drive 2 hours to get to a hospital to deliver a child, when we have qualified, midwives in all of our states that could support the care if we could expand some of the Practice Act. Those are real issues that could result in loss of life or poor outcomes because we just didn't support some of these initiatives, or because a larger lobbyist or a more financially giving campaign was against it. We've got to get out there and get our voices, and those stories are going to be really critical.
Absolutely. And Natalie, what about you?
Yeah, my previous state in Nevada, I'm a labor and delivery nurse by background, and women's health is my passion. Besides nurses, women's health is got both of them there. We didn't have a maternal mortality review committee. We had an infant and children, but we didn't have a maternal one. And so some local midwives and myself and a handful of other people started advocating with our legislative body starting in 2018. And it really came from each of us each of us being impacted by patient care or a patient death. Mine specifically was around postpartum hypertension. She was only 30, and she came in too late, and she didn't survive. And that really fueled me we needed an MMRC, a Maternal Mortality Review Committee, to see how we could impact our communities and how we could save more mothers from these bad outcomes. And luckily, it was passed in 2019 and it became effective in January of 2020. It was governor appointed that you could be a part of this committee. So my application was number one and got to sit on that committee for 3 years, which I absolutely loved. Was during COVID, so it was definitely interesting. I saw pivoting from in-person to WebEx to reviewing these, but it was such an enlightening time. And I know that committee continues on and is doing really important work.
Absolutely. Yeah, that's a great example. I'm so sorry to hear about that patient, but I'm glad that some good came out of it. Yeah, so I wanted to move on. We've also touched a little bit on skills that are needed to, participate in advocacy, and it is out of people's comfort zone a lot of the time. So what skills should CNOs employ to effectively engage with lawmakers and influence policy? And Rudy, I'll let you take this one first.
I would say fake it till you make it. I'm an introvert, ISTJ, my 4 letters are ISTJ. So it is hard for me to go out there, and I find it fatiguing for me to go out and do some of these things. Oftentimes I'll come home from work and my wife will ask me if I've used all my words for the day. So I think we need to fake it till we make it, because what we need to do is be passionate about what it is that we are really, really trying to advance. And that passion will lead us to where we need to go. You put me in a black tie event, I'm going to be pretty uncomfortable. But you get me talking about nursing, and you can take a seat because I'm going to be here for a while. And so, if nursing and leading and supporting our teams is what our passion is, then lean into that and then just fake it till you make it, because our passion is what's going to come across. And regardless of whether we're nurses at the bedside or we're nurses in leadership roles, we're all still nurses. The only difference for me today versus when I was at the bedside is that my patients are vertical. And so taking care of our staff, taking care of our teams, who are ultimately going to take care of our patients, is where my passion is. And so getting me to talk about that is easy.
Mm-hmm. Absolutely.
You want to talk about the stock market? You're going to make me uncomfortable. But
for sure. Natalie, what are your thoughts?
I think it starts with, I believe all states have nurses at the Capitol Day. I think that's really important. As a staff nurse, I went to my first one a year out of school, and it really just changed the way I looked at things and really wanted to get involved. So I just started doing my own research about how to understand local, state, and federal legislation. And really, I mentioned it before, our AONL partners, our ANA really has great policy alerts and tools to educate yourself and get knowledgeable. I would agree with Ruby. I like to think I'm an extrovert, but at times I am definitely an introvert and get uncomfortable in some situations. But I agree, like just pushing through and faking it until you make it is a great thing to think of, because the more you get to talk about what you're passionate about or what you're, want to be involved in, especially as nurses and with the nursing division, it really helps to bring out the extrovert side of me. And I really want to sit down and talk, just like Rudy said. So I think just encouraging and finding ways to educate yourself and get involved. And we've said it, I think the entirety of this conversation is build those relationships. There's another good thing, for hospitals that do have the government relations or public affairs department here at Denver Health, they actually we have a weekly leadership huddle, but they try to jump on at least once a month to provide any updates and necessary around government relations. Especially over the last 4 or 5 months, they've been very vocal in our leadership huddles, but it's really helpful because we're trying to educate our entire leadership force, not just one area of leadership. And it's been very impactful, so much so people have reached out to learn more. So I think having that, if you have that at your organization, is a really great way to stay involved and learn more about what's going on.
Absolutely. And Claire, what are your thoughts?
I think those are all really great points. I think what's really important too is that CNOs need to realize and need to embrace the fact that they don't have to be policy wonks or policy experts to shape meaningful change, because they already have what it takes. But what they do need to do is they need to show up, and they need to show up more than once a year for example, when American Organization for Nursing Leadership does Advocacy Day, that's one time a year when we all show up collectively. But we do so much in between those times that actually build us up to that visit to the Hill. So, it's just like training for any kind of sports competition or anything like that. You can't just train once and think you're going to go out and run a marathon or something like that. You have to train frequently, which means you have to show up, and you have to be there. Having those communication skills, whether you're an introvert or extrovert, is important. Just talk about what you're passionate about and connect the dots for the legislatures so that they know how the policies that they're approving and implementing or introducing, how that has an impact on nursing practice, nursing leadership practice. So help them connect the dots with the patients and organizations. And then, of course, that communication is important, and frequent communication builds that trust. It's not that you're the squeaky wheel. It's the fact that you're following their work. And that's flattering to them that you're following their work and that work is important to you, because they were voted in office for a reason. And you can help them become that reason and understand what's important by, of course, offering yourself as a resource to the legislator, which I mentioned before. You are that subject matter expert. And when you're going to that legislator, it's not that you're always asking for something. What you're going to them for is supporting their position or fortifying their position through data, through storytelling, credibility, your unique insights as a nurse leader, and recognize those gifts that you have, but also recognize you don't have to be that policy expert or a policy major or something like that. So I sometimes think nurses don't realize the power that they have in their knowledge.
Mm-hmm. Absolutely. And you mentioned communication skills. Part of that is written communication skills. So I wanted to ask, this is a little more in the nitty gritty of it, but what are some best practices or tips that each of you have for writing policy briefs or letters or testimony as a nursing executive? And Natalie, I'll let you take this one first.
Rewriting it a lot.
Mm-hmm. Yeah.
It's kind of like that email you go to send that you're just like, I'm frustrated right now. I probably shouldn't send this email. So I usually do a couple versions, my very frustrated voice, and then I will delete it all and start again. Luckily, as I said, we have an advocacy or a government relations group here. And so I will usually send it to them to just read over, see if I'm on the right track. Should I add anything more? Should I take something out? Especially with testimony, because those are usually 2 to 3 minutes if you're going up to the Hill to be there in person. So they help me bring it down, because I tend to put a lot of information or a lot of a really big story in there. And so they really help me pin that down. But I think if you're a rural hospital and you may not have access to that, leaning over to your partner or colleague and having a conversation, or, getting on the phone and talking with one of your other CNOs or CNAs in the state, just to go, hey, what do you think about this? Do you have time to review it? It's always good to have a couple extra set of eyes on there, just to make sure that, you're not your tone, or I know we shouldn't read tone, but sometimes tone does come out in what we write. And so I wanted to make sure that you're engaging and you're building that relationship, not breaking it down.
Absolutely. And Claire, what are your thoughts?
Well, I think those are great points too, especially the refining of the message. And with that refinement of the message, be succinct, get to the point. And, as nurses, we use a lot of abbreviations and jargon and things like that. Don't do that. Don't assume they know what those abbreviations and that jargon means. Just be clear. And if you can, limit to one issue. because I know that I've got 5 minutes with this person. I'm going to go in and give them my laundry list. Pick your top 2 or your top 1, those key issues. And with that key issue, associated stories, associated examples, those types of things are very important, and data related to that one issue, because they're thinking about, I got to get on the floor for this vote. I've got to get out and see this group of constituents. I've got to do this. You want to get their focused, undivided attention. And the way to do that is to be succinct with your message, eliminate jargon and abbreviations, and focus on a key issue that's surrounded by data.
Absolutely. And then Rudy, what are your thoughts?
Well, I started laughing when you asked the question, because I've struggled a bit with that, because I can crank out a corporate policy in minutes. I mean, that's the world we live in. But there's so many different styles of writing. An email is different than a corporate policy. In email, I go with a military acronym, the BLUF, the bottom line up front, typically 1 to 2 sentences, no more than that. But then you have, I'm attending I went back to school, I'm getting a PhD. That's a totally different type of writing. And so with all of these different styles of writing, what I've realized is drafts. And with not draft number 1, but likely draft number 10, and get comfortable with people criticizing what it is that I'm writing, and understanding that they're not being critical of me. It's just a matter of us getting it out there. So like Natalie said, I think it's important that we get more eyes on it, so that people can understand what it is you're trying to get across. What is that message? And I agree with Claire. We need to be concise and watch our acronyms. We use them so often. I mean, it's like being at dinner and having a conversation with other nurses, that other people at the table who may not be clinical are thinking, why are we talking about this? We just get so comfortable in our own space. We need to get used to not doing that in our writings as well. So draft.
Mm-hmm. Absolutely. As an editor, I can confirm, edit it.
Yeah.
Absolutely. So how can CNOs help enlist other members of the executive team to advocate for nursing? And Claire, I'll let you take this one first.
Well, most executive teams are made up of multidisciplines, and we can't do our jobs in a vacuum. And it's the same thing with the legislative process and advocacy. We cannot do this work in a vacuum. And we have all of those resources generally at our fingertips. Beyond hospital government relations experts and those types of folks, you have access to all of your data. So you have a place to get your data. You can also engage with your media and your communications department, because usually they're the first call from legislator offices for a statement, for information, those types of things. And then I think it's important too that you elevate yourself as a nurse leader within the executive team that you're on, to let them know this is a passion of yours, and that you have the knowledge that can actually help them tell the story, and that story is important. So it's just all part of engaging with our colleagues on our executive team and helping them tell the story as you're telling the story.
Absolutely. Rudy, what are your thoughts?
Well, I couldn't agree more, right? It's impossible for us to have all of the information. We have to engage with our leadership team. But I also like the idea of our legislators. This isn't a show for me. It's about nursing. And so I shouldn't be the only one that they see. And so being able to bring other nurses to testify with our legislators, to be able to share their voices and just share their stories, is really, really important. So while I think leveraging our colleagues at the executive level to get the data, to get the numbers that we need to present our stories is important, but also leveraging the other nurses around us. I recently had all of our CNOs at the nursing day at the Capitol, and that was really, really important. They took all of the directors with them as well. And so, next year we're going to be taking and sending a bunch of direct care nurses there as well. So while I agree with Claire, we can't be just a one-time thing. We do need to give these folks some exposure so that they're ready to take the baton when it's their time.
Mm-hmm. Absolutely. And then Natalie, what are your thoughts?
I think with the executive team, we are fortunate that we have a shared vision, and that shared vision is the safety of our patients, of our community, and of our staff. And so I think having that shared vision and discussing and us all, our CEO is extremely involved in government relations, which we are very thankful for, but just following suit and being part of the team that goes to the Capitol or provides testimony, not just from a nursing lens, but from an operational lens or from a finance lens. I think every part of the story is as important to share and important to make sure that we can continue to provide the care that our community and our patients need.
Absolutely. Well, thank you all once again for this excellent discussion. This is going to bring us to our Q&A portion of the program. So we would now like to invite all of you in the audience to ask live questions of our panelists. As a reminder, if you are participating in the live program, to submit a question, please click on the Q&A widget at the bottom of your screen. It might already be open and appear on the left side of your screen. And please note that your questions will remain anonymous and will not be viewed by other audience members. Okay, first we have, how can CNOs help equip the next generation of nursing leaders with the skills and knowledge to advocate for nursing policy? Let's see, Claire, I'll let you take this first.
Well, I think Rudy hit it on the head earlier when he said, don't limit the conversation to the executive team or you as a CNO. Bring in those who are having lived experiences, your nurses at the front line. And honestly, today's leaders alone are not going to solve these problems. We have to prepare that next generation. And one of the things that's incumbent upon us as nurse leaders leading the next generation is that we have to model that that behavior. Advocacy is not a side job. Quality is not a side job. Experience is not, employee engagement is not a side job. It's part of the fabric of what we do every single day. And I think we have that unique ability to pull advocacy in as part of that when we're talking to our teams, especially those emerging leaders and those nurses that are new to the profession. And, again, bringing those nurse leaders to AONL Advocacy Day. We see the first time nurses come, the nurses come for the first time. It's just such an eye opener for them. And they're just so pumped that they can be a part of this. How do we keep that momentum going? And how do we demonstrate to them on a consistent basis that their voice does matter? And that is the thing, is that once you let them know that their voice matters, they just keep going and going. And that's a good thing.
Absolutely. Natalie, what are your thoughts?
I like to say it starts in nursing school. And I think it's difficult, especially when there's so much that needs to be on the curriculum, whether it's an associate's or a bachelor's, and trying to fit policy and advocacy into that curriculum is probably extremely difficult. However, we've worked with partnering with schools, our local schools around here, on how we could start to incorporate more policy and more advocacy from the get-go. Because I think, as you transition into practice and then start into your career of nursing, that can tend to get lost, that you have a voice. Claire's mentioned it a few times, that just being a subject matter expert, being a registered nurse, and having a voice is an extremely important. And so we need to teach them from the beginning that their voice does matter. I like what Claire said about how do we demonstrate or show that their voice is having an impact and it is making change. That is definitely something I'm going to take away and think about. But really getting them from the beginning. And then I encourage my nurse managers and my directors and nurses to be part of boards. I think that's a good place to start, whether it's a local board or a health community advisory or something that you matter, Boys and Girls Club. I mean, it doesn't have to be around nursing, but just getting involved in your community and being on that board, you start to see how your impact makes a difference at your local level. And sometimes that ignites to just keep climbing and keep doing other things and getting involved. So.
Absolutely. And then Rudy, what do you think?
Yeah, I agree with everybody. Exposure is, to me, probably one of the biggest impacts. People don't recognize the power in their voice until they start using it. And so sometimes just pulling people along to say, you need to be here and you need to speak to these folks is really powerful. Going to places like, AONL's national conference and forcing my leaders to meet other leaders outside of our own organization has been incredibly rewarding for them as they start to build their network, if you will. I oftentimes will tell folks that healthcare, nursing specifically, is the only industry, healthcare is included, but we're the only industry where stealing somebody else's idea not only okay, but it's encouraged because we are ultimately trying to do the same thing, and that's improved outcomes. But we should also be looking at folks that are, doing things at the legislative level. What can we do to learn from that? We recently passed a bill here in Wisconsin where we allow recently separated military medical personnel to work in our hospitals as licensed professionals while they're in school. So we're utilizing and leveraging those skills. And there are many hospital associations that have reached out to us and said, how did you guys do that? And what are your outcomes? And so we need to be sharing that information, and we need to be able to leverage that through our networks and connecting. And really that's done through exposure.
Absolutely. Okay, so I think we have time for one or two more. So what are two or three key takeaways that each of you want CNOs to take away from this discussion? And Rudy, I'll kick it to you first.
Stay true to yourself, find your passion, and remain relevant. I think those are so important to me, right? Like we got to remain relevant in our profession and our discipline. Know our data, understand our workforce, understand the needs of our teams, and it's changing. We've got 5 generations working at the bedside together. We've got to stay passionate. Find what it is we're passionate about. Natalie says she's passionate about women's health, and as a result of that, she's driven change in her state around women's health. We've got to remain passionate about those things, and then advance those initiatives, and then be true to ourselves. We all got into healthcare, we all became nurses, not because we all wanted to go out and buy a jet and live on an island, right? We did this because we care about people. And it doesn't matter if our patients are horizontal or if they're vertical. Stay relevant, stay true to who you are, because that's how you're going to define your leadership and your legacy when it's all over.
Absolutely. Natalie, what are your thoughts?
I think advocacy isn't extra, it's essential. Claire mentioned we don't need to be policy experts to get started. I think we just need to show up. We need to show up with our stories, with our data and our values. And as Rudy said, talk about our passions and just be visible and be seen and get out there and just share that passion, whether it is women's health or it's around workplace safety or it's around staffing concerns. How do you get out there and just share as much as your passion with as many people as can hear? We've said it, both Claire and Rudy said it. If you're not invited to the table, go ahead and pull up a chair and start the conversation, because that's how we get our passion and our values out in meaningful change in legislation.
Absolutely. And then last but not least, Claire, what are your thoughts?
Yeah, I think thinking about it in the sense of don't ask to be invited, and think about it like this: if not you, who? Who's going to do this? And don't leave it to say, oh, somebody else will do this. I mean, you don't leave dishes in the sink and think, oh, somebody else is going to do this if you live by yourself, because they're not. You have to think about you being a leader in this, and you can choose the type of leader you want to be. But it will definitely be something that you can connect with, and you can make it. You can see the difference when you do speak about things. You can see the difference. You can see the light bulbs going off, and that's rewarding.
Absolutely. Well, unfortunately, that's all the time we have for questions today. Thank you all again for this incredible discussion about this really important topic. So in closing, please note that our next Winning Edge program on July 8th will cover the Winning Edge for Rebuilding Patient and Public Trust. A live clickable link will appear at the close of this program, taking you to our registration page for that event. Remember to follow along all week for continued coverage on advancing nursing advocacy and legislation on our website, healthleadersmedia.com. I want to thank our panelists once again for this excellent discussion. And finally, thank you to everyone in our audience for participating. We hope you enjoyed today's program, and we look forward to seeing you during our next Winning Edge program on rebuilding patient and public trust. Thank you, everybody.